I want you to try and imagine a scenario. You're sitting at home and you have sudden onset of chest pain, so you're rushed to A&E. As you're lying in your bed, staff around you are running round trying to get things done. You even notice there's patients lying in beds in corridors. You're scared, you're in pain, and 1,000 worst case scenarios are running through your mind. But the one thing bringing you comfort at this time is, I'm in the best place possible. As medical students, this is often our go-to line to bring people comfort when they're scared or afraid in hospital. We remind them that they're in a place with medical equipment and resources to give them the best quality care possible. But now let's switch up the scenario a little bit. We're no longer in the UK, we're somewhere else across the world. You might be thinking, I've seen images on social media or I've been on holiday where I've seen the hospitals in other places. They're amazing, they're incredible. That wouldn't be so bad. But what about one of those countries with extremely high levels of poverty? This time, as you're rushed through the doors of A&E, you're still in pain, you're still scared. But there's not just patients lying in corridors now, there's patients lying in makeshift beds on the floor. Staff are in the middle of a 48-hour shift and they don't have the funding to order simple blood tests, never mind advanced medical scanning. Could you really say at this point, you're in the best place possible? I know which scenario I'd rather be in. This is what is described as global health inequalities. It's where one person born in one country might receive poorer quality healthcare than if they were born in another. This is simply due to lack of funding and resources. Surely this isn't fair. But this is where SWOT steps in.
Myself and Rebecca are President and Vice President of the medical student-run charitable society SWOT, which stands for Students Working Overseas Trust. Our aim is to raise money for essential medical supplies for impoverished hospitals all around the world. SWOT represents the principles of the Queen's Social Charter, which promotes a positive impact on society as well as a commitment to equality. Sometimes when we fundraise in the general public, people become less interested in donating when they find out that the money we raise goes to hospitals overseas. But why is that? Let's cast our mind back to March 2020. The angst in our communities is growing and the pressure on the NHS is rising. The fear our hospitals are becoming overwhelmed is becoming a reality, and shortages of PPE are being reported daily in hospitals and in care homes. We're growing frightened for our friends, family members and frontline workers who are fighting COVID-19 head on. Now, imagine you live in a country with high levels of poverty. You may not have a roof over your head, enough food to feed your family, and infectious diseases are highly prevalent due to poor sanitation. Hospitals in these countries may not have PPE, soap or clean water on a regular day, let alone during a global pandemic. Because of this, the baseline level of care that we can receive here in the UK simply cannot be met in these countries. Healthcare workers who work in impoverished hospitals want nothing more than to provide the highest quality care for their patients, but due to a lack of equipment and facilities, they must simply make do with what they have. Poverty exists everywhere globally, but fact remains, if you fall ill here in the UK, you will receive high quality healthcare for free. Depending on where you're born, you may not have this same luxury. We cannot advocate for our own healthcare system without advocating for all healthcare systems.
We're all extremely protective of our NHS, and rightly so. It's one of the best and fairest healthcare systems around the world. Many countries are trying to model their healthcare systems and ours here in the UK, but some simply can't afford to do so. As a result, diseases which are viewed of as historic here in the UK are claiming thousands of lives worldwide every year. Additionally, with the increase in travel and trade between countries, it's now easier than ever for diseases to move from one place to another. If we don't invest in global health now, it's going to come back to affect us, our children, our grandchildren and beyond, putting an already struggling NHS under even further pressure. Is this really a risk you're willing to take?
Using the coronavirus pandemic as an example, we can see how quickly diseases can spread from one side of the globe to another. This demonstrates how healthcare on a global scale can be hugely influential to healthcare on a local scale. If we can aid hospitals in other countries, this will benefit us in the long run too, as the more accessible healthcare is to all globally, the more equipped communities will be to prevent disease, COVID-19 being only one of many. We must also look from the perspective of what we can do at a local scale to benefit society globally. Each small act we can do in our local communities will have a ripple effect to communities worldwide. Whether it be a small donation, a conversation with friends and family, or taking time to educate yourself on global health inequality and what we can do to change it, will have a massive impact on the world if we all make the conscious effort to do so.